Joining us this morning is Dr. Richard Besser, who previously served as acting director of the CDC and is now the president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, good morning. We have so many questions for you.
Good morning. It's great to be here.
Well, let's start with the survey results that Hallie just mentioned in her spot said that vaccine acceptance among pregnant women is less than 45%. Obviously, I think, new moms or moms-to-be are concerned that there aren't as many data points for expecting mothers. So are there harmful side effects? Should mothers be worried, and should they get the vaccine?
Yeah, first point I want to make is that survey was done back in October, and that was a time before there were any licensed COVID vaccines, and so the acceptance of vaccines at that point was lower for all groups across the country. And one of the things we're seeing is that as more and more people know family and friends who've gotten the vaccine, the desire to get vaccinated across all groups is going up. When it comes to pregnancy, I'm a pediatrician, I'm a parent. These are personal decisions, and I'm really glad that the recommendations now make the vaccine available to pregnant people to make that decision, to decide, to think about, well, what is my risk of exposure? Do I work in a sector where I'm very likely to get exposed? What is my risk of having severe COVID if I am infected? While pregnant women are at greater risk of having severe COVID than non-pregnant women, the risk is still not that high. And so you have to weigh a lot of factors. And the biggest thing I think that people are recommending is if you're in a situation where you're very likely or you have a high likelihood of being exposed to COVID, then vaccination is something you should consider because the science is suggesting that it is safe. We won't know for sure until the trials are done, but there's nothing about the vaccines that have been licensed so far that raise any red flags, as Dr. Fauci was saying, about increased risk for people who are pregnant.
Dr. Besser, let me shift gears just a moment. We talked about this at the top of the show. We're learning this morning that pharmaceutical company Merck will be helping to make Johnson & Johnson's vaccine. They're competitors, but they're coming together now to produce the vaccine. What do you make of this announcement?
Yeah, I mean, before I answer that, I want viewers to know that our foundation has significant stock in J&J. Mm-hmm. But when I heard that announcement, it gives me hope. One of the things that we're really concerned about are variant strains of COVID that are spreading around the globe, that are increasing here in the United States. And so there really is a race to get people vaccinated. And seeing two big companies come together and say, well, working together, we can provide a greater supply is a really positive sign. I'm on the Restart Commission here in New Jersey, and we had a meeting yesterday. And what I was hearing from our state health commissioner is what I've heard from commissioners across the country, and it's that states are ready to vaccinate more people if there is more vaccine. Mm-hmm. So anything that will speed up the delivery of vaccine to states will improve the vaccination rates and will help provide us help protect us as a nation.
Yeah, demand continues to outstrip supply.
Mm-hmm. Hey, Dr. Besser, really quickly, Dr. Walensky of the CDC said with all these variants, she's worried about states rolling back lockdowns, things like that. Are we in a place where we're making this decision too quickly?
Al, if Dr. Walensky, the CDC director, is worried, I'm worried as well. And I think that we have to keep at it for a couple months more. At that point, there's going to be plenty of vaccine for everyone who wants to be vaccinated. If we roll things back too quickly, we could see another wave that spreads across our country. And while everyone will be affected, we have seen over the past year, communities of color, lower income communities have been hit so hard by this pandemic. We have to keep this under control by following public health guidance for just a little bit longer.
Okay, we have to hold on.
Dr. Besser, thank you so much for joining us. I wish we had more time, but you answered a lot for us this morning.
My pleasure. Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.